problem I'm having today with this discussion and where we're going and the vote I've eventually got to place is we require kids to get immunizations, and some of them may actually be putting other kids at risk if they're getting the chicken pox immunization and all it's remote, then it is possible that that gets transmitted. We have other immunizations that we require that don't have as much reliability as we would like, so they're able to spread their disease. And yet we're trying to keep a safe place at school for those that are compromised, their immune system is compromised through chemotherapy or lupus or whatever it is. If I was a parent and I had a child in that category, from what I'm hearing, I wouldn't trust the public school anyway. And yet it seems like you would want to create a safe cocoon around that as much as you can. And yet we're jumping through a lot of hoops to force a lot of other people out when we still don't have a safe situation in school. No. This panel is concerned primarily with education, and certainly health is a huge part of that, and I've carried health-related bills before this panel, as you know. And so I'm really kind of struggling with this. At Disneyland, you have a lot of tourists there, so they're not vaccinated anyway. We don't require tourists coming into California, and by the way, we're a #1 tourist destination. California, our economy depends on it. We don't say, have you got your 27 vaccines or whatever it is before they come and go to Disneyland or any other place. And so you're requiring our own parents to jump through hoops to do all these things in the interest of public health, and yet we're still exposed. Because I know in my local school district for my kids, and they were vaccinated, thank you very much, over 55 languages and dialects, an immigrant community, a lot of stuff coming in. Not everybody's getting vaccinated. I don't know. I understand and appreciate that our medical technology has advanced so far, and immunizations are probably one of the greatest developments that we've seen in the last 100 years, or however long they've been happening. But it certainly has saved us from a lot of childhood deaths and other things. But not everything in life is easily accomplished with advancements without trade-offs on the other side. And so where I'm leaning right now and will probably vote is against your bill, because I think the trade-off of giving up personal freedoms, even if your child gets sick because of that personal freedom and personal choice, I think that that's a threshold that should be very carefully evaluated before we hand it over to a government mandate. And I don't believe we've reached that threshold yet. If we were talking about an Ebola outbreak and we had an inoculation against that, I would probably have a different outcome. But we got, what, 644 cases of measles because there was some tourists or some kids that weren't immunized, and those that were immunized for the most part, unless it had worn off, were safe. And so I can appreciate the motivation for you bringing the bill. I don't think it's fully cooked. I don't know that it will ever be fully cooked for my threshold of support, but thank you for the opportunity to at least be enlightened, educated, and to make a decision on it.